This is my audience. Have you ever bought a pair of shoes before and thought you were walking on sunshine, and then turned around and bought another pair of shoes and they didn't fit so well? That's because every person should buy a very specific type of shoe for their own individual foot type. Today we will look at the anatomy of the lower leg, joint alignment, as well as analyze a proper gait cycle, identify shoes to avoid, then we will determine our own foot type, and then we will ultimately be able to choose the right shoe. My name is Justin Buccille, and I've been a physical therapist assistant for 13 years. Let's get straight into the anatomy of the tire, or the wear of a tire. It can wear on the inside or outside sometimes when you have an alignment issue. So the same can happen with the human body, considering a varus bow-legged knee will wear too much on the inside of the knee cartilage. A valgus bow-legged knee will wear too much on the outside of the knee. To understand a little bit of the anatomy that's associated with the lower leg, you have a femur that at the bottom of the femur it's covered by a hyaline cartilage. The tibia on the bottom part of the knee has a tibial plateau, and on top of that tibial plateau we have a meniscus, which is going to be the cushion that's inside the knee that's going to prevent any type of pain or arthritis or later bone on bone that you would see on the knee valgus. We're going to focus on knee valgus today because it's the most common that I see from improper wearing of shoes. According to Zoe et al. 2022, from a Journal of Computers and Biology and Medicine, they say that the valgus malalignment can increase to a rapid osteoarthritis. So keep that in mind, as well as Sasaki et al. From Arthroplasty Today in 2022, they also claim that age contributes to the valgus deformity. So there are some other outliers, including obesity, that can lead to the valgus deformity. So it can be genetic as well. It's not just all specific to the shoe type that you wear. Now we will move on to understand the ankle anatomy. Supination over here to the right is going to be when the ankle or the talus rotates to the right side, which is also known as a high arch. Then you have the neutral position where it's where we want to be at. Pronation over here to the left is when the talus is going to rotate to the left side, also known as a flat foot. According to Monjuez, Mazzatera, Pardo, 2011 from SPCH, they say that patellofemoral pain can be associated with this pronation, and that the best way to correct that is to increase the arch, usually through an orthotic, if it's an extreme case, and that it can relieve symptoms of patellofemoral pain. Now that we understand the anatomy of the knee and ankle, we can move on to understand a proper gait cycle, which would include 5 independent different stages within the gait cycle, including the initial contact, the foot flat, the mid stance, the heel lift, and the toe off. If somebody's wearing a shoe like high heels, it will only include 2 stages of the gait cycle, which is the heel off, heel lift, and toe off, which in time will result in a increased tightness of the Achilles tendon, also known as the heel cord, which will result in balance deficits later in life. Once the Achilles tendon gets tight, there's really nothing you can do about it. I had an 80-year-old patient once who was a business lady who always wore high heels, and as a result, we had to walk with high heels and with a walker, and her balance was really not well, but we were able to functionally walk with high heels on. According to Cronin 2014 from Elsevier magazine, the effects of high heels extend all the way from the ankles to the knees, all the way up to the hips and the lower spine. So it can affect very specific areas to the body and even the lower back. So we want to keep that in mind. So now that we understand gait cycles, anatomy of the body, we want to analyze and figure out our own specific foot type. The next time you're in a shower or a bathtub and you get your foot wet, I want you to step on a dry surface and analyze your footprint. If it's a very flat footprint like the one on the right, you're an overpronator. The neutral position should look like this. If your arch looks good and it's in a neutral position, the middle one is what you're looking for. If you have a very high arch, it'll be supinated like the one on the left. If you're supinated, you're going to want to have an arch that has some play into it and some give, like a gel Nimbus shoe from ASICS. Another test that you can perform is removing your shoe. If you have a normal wear pattern, it will wear in the middle of your shoe. If it wears to the inside of your shoe, you're going to be an overpronator, flat-footed. You're going to want to buy a shoe for pronators. If it wears on the outside of the shoe, you're going to be having that high arch, or you're going to want an arch that gives, like a gel Nimbus shoe. Once you understand all of that, you can choose the right shoe. Choosing the right shoe is a matter of Googling specific brands that are reputable, including Hoka, ASICS, Under Armour, Nike, something of that matter. Under Armour has an area where you can Google shoes for pronators or supinators, and they will show their entire lineup for pronators and supinators. Once you've bought that shoe, after 2 or 3 months, you should be able to analyze the tread wear on the bottom, and it should be in the middle. It could take a little trial and error to get it correct. So if you can't get it corrected, you may have to talk to your doctor to get referred to an orthotics. They might have to actually build a foot orthotic with an arch lift that is hard and specific for that individual person. Other shoes to avoid are flip-flops, definitely high heels again, and Nike Shocks. Hey Dudes are another pair of shoes that a lot of people like and a lot of college kids are wearing right now, but they don't have any arch support. Once you go through this trial and error phase of trying to figure out your specific foot type and buy the right shoe, your joints will thank you.